Okay, PJ, let's talk about rashes. They're so common. They're with viruses and allergies and antibiotics. Let's talk about a couple of the common rashes that we see in the office, and we can hopefully help families not get so crazy when they do have a rash.
Yeah, so there's lots of things that can cause rashes, like Dr. Jill said, antibiotics, viruses, allergies. Many times, in kids especially, there's lots of viral rashes that can happen, which any viral rash, no matter what it is, can come and go for up to 2 weeks sometimes, so it takes a while to go away. Many times we see it, we panic. Fevers can cause rashes. If there are fevers, you can get a little bit of rash, goes away within a couple hours, so don't panic with the first sign of a rash. Give it some time and see how it pans out a little bit. If there's any sort of allergic rash, antibiotics can cause rashes, pollen, things like that, cat, dogs. You can try a little bit of Benadryl if you wanted to. That also goes hand in hand with eczema that can happen, a little bit of dry skin, which if you are having any dry skin, any unscented moisturizer like Aquaphor, Eucerin, Aveeno, CeraVe, things like that are all okay to use. You want creams, not lotions, or ointments are good as well.
Ointments are great too. Absolutely. Yeah. Some of the hot rashes that we see a lot in the office, number one is fifth disease. Fifth disease was just the fifth virus that caused a rash, and that's why they call it that. It has that slap cheek appearance and a very lacy rash on the trunk and the upper arms. That's very common. Usually that has no prodrome or no symptoms prior, and it ends up just being a rash that we see. It's benign. If a woman is pregnant, that could be an issue, but other than that, for children, it's fine. The other common one is roseola. Roseola happens about 3 or 4 days of a very high temperature, really no other symptoms, and all of a sudden the fever breaks and the rash develops all over. So those are very common ones that we do see. One thing about these rashes, everyone wants them gone. Once we diagnose it, the next day they want it gone. Keep in mind that a fever, hot water in a bath, running around, tight clothing, anything that dilates the blood vessels and warms the skin will make the rash look like it's coming back. Know that this can wax and wane over a few days to even, like you said, a couple of weeks before it actually goes away.
The sun is also another big trigger of the rashes that we get, all the prickly heat, things like that. So give that time if it happens.
Absolutely. And one final common rash that we see is with amoxicillin usually. It's day 7 or 8, the kid's feeling better, everyone's happy, nothing has changed, the parents have given the medicine just like it's prescribed, and a rash breaks out. Kind of a flat rash, sometimes it's even hives that can happen. That's a very common side effect of a penicillin. It's not an allergy to penicillin. Allergies are usually 1 or 2 or 3 doses into the medication. That's when we need to hear from you. But a day 7 or 8 rash on amoxicillin doesn't mean they're allergic. It just means that we can try another antibiotic in the future. But you should call us just to make sure everything's okay, but we don't panic about those rashes.
Thank you.
Thanks.